I hope you're doing well. Today we are going to look at foreign body aspiration in children. Let's look at the anatomy of the airway. Here you have the mouth, you have the nasal cavity, you have the pharynx, which is a muscle-lined space that connects the nostrils, the mouth, to the larynx. You have the larynx, which is a cylindrical group of muscles, cartilage and soft tissues that contains vocal cords. You have the epiglottis, which protects the larynx. And then you have the trachea, that allows air entry. The trachea divides into the primary bronchi, secondary bronchi, tertiary bronchi, alveoli, and until you reach the lungs. You should note here that the right bronchostem bronchi takes off at a less acute angle than the left main stem bronchi. In other words, the right primary bronchi has a less acute angle than the left primary bronchi. Hence, foreign bodies tend to log in the right-sided airway. These are common locations. Again, here we are going to note that the right main bronchi or the primary bronchi has the largest percentage, which is 30 to 40%. The larynx has the least percentage, which is 1 to 5%. Foreign body aspiration mostly occurs in the following groups. 1. Children less than 3 years of age, more in males than females, and patients with developmental delays. Why is it common in these age groups and individuals? Because they lack the molars to grind the foods. They put objects often in their mouth due to natural curiosity, and then they lack the coordination of swallowing and the closure of the epiglottis. Epiglottis closes to protect food items from entering the airway before you swallow. And then they tend to be playing with these objects usually when aspiration occurs. Let's look at the risk factors. 1. Being young, what's 1 to 3 years of age. Improper supervision by the parents or caretakers. Access to these small objects if they are readily available. Then low income and rural areas is also a risk factor for foreign body aspiration. Then lack of awareness about the dangers of foreign body aspiration. Let's look at the commonly swallowed or taken in foreign bodies. They include the buttons, coins, foods, especially nuts. Note that the challenge with most of these foreign bodies is that they are not radio opaque, which makes them difficult to detect radiographically. The common presentation, there is a history of a sudden, not this one, sudden episode of cough or choking while eating. In laryngeal body aspiration, the child may present with hoarseness of the voice, croupy cough, apnea, hemoptysis, dyspnea, with wheeze or cyanosis. Tracheal foreign body, there might be an asthmatic-like wheeze. In bronchial foreign body aspiration, initially there is cough, then there is a blood-stained sputum. Sometimes the child may be asymptomatic and you may only see signs of asphyxia or wheezing. Fever may also be present. How do you diagnose foreign body aspiration. We shall start from history. So maybe a parent or a caretaker witnessed this child swallowing. Then there is sudden onset of cough, wheeze, or choking. Segmental or lobar pneumonia that has failed to respond to antibiotics. This child has been treated for long, but they are not responding. Then, on examination, there might be a unilateral wheeze, touch meaning unlimited expansion on the affected side. Then, diversion of the trachea or apex beat may also indicate challenge, and then an increase in breath sounds or decrease in breath sounds in a certain region. So the breath sounds may be either dull or hyper resonant. Then on percussion, there is decreased percussion note on a specific side. So what are differential diagnoses of foreign body aspiration? One, pediatric asthma, bronchiolitis, pneumonia and pneumonitis, atelectasis, emphysema, lung abscess. So after you've done your history, you've obtained the history, then also you've done physical exam. You might order for these investigations to guide you on the treatment. One, plain chest x-ray should be obtained at full expiration to detect an area of hyper-infiltration or collapse. There might be a mediastinal shift away from the affected side, or the foreign body itself may be seen on chest X-ray in case it is readily opaque. You can also use a flexible bronchoscopy. It can be used to locate an aspirated body, but remember that a rigid bronchoscopy is easier or for removing the foreign body. Also, you can do fluoroscopy, which is said to be more sensitive than a plain chest X-ray, but it's rarely done. So this is our plain chest X-ray, a sample, and here there is the right-sided air trapping around here. So how do you manage? The first aid for a choking child. You need to place this child in a downhead position on your thigh, on your hand, and then you give 5 blows with the heel of the hand. Yeah, 5 blows with the heel of the hand. If choking persists, you can turn that child the other way around, and then you give 5 uh, these are chest thrusts with 2 fingers from the lower half of the sternum, lower part of the sternum. So this slide here is explained by this following slides. For infants, you lay a child in a head down position on one of your arms or thighs. Strike the middle of the infant's back 5 times with the heel of your hand. If obstruction persists, turn the infant over and give 5 firm chest thrusts with 2 fingers on the lower half of the sternum. Yeah, this we have said this. And then if obstruction persists, check the child's mouth for any obstruction that can be removed. All this has also been explained in the previous slide. And then for other children that you may not put on your hand, the child may sit, kneel, or lie. Then you strike the child's back 5 times with the heel of your hand. If obstruction persists, you can perform what we call you can perform a chest thrust, also like the other one. And in case that persists, you can perform what we call an abdominal thrusts. What you do here, you go behind the child and then you pass your arms around the child's body. You form a fist with one hand immediately below the sternum, and then you use the other hand to hold over the fist, and you then perform a sharp thrust, abdominal thrust. In other words, you move the hands upwards. That fist that you formed, you move it upwards. Repeat this 5 times. Then check the child's mouth for any obstruction. Repeat this if necessary with back slaps. Once this has been done, it's important to check the patterns of the airway by looking for chest movement, listening for breath sounds, and feeling for the breath. And then later, the treatment of suspected foreign body aspiration. Refer the child to a hospital where diagnosis is possible and the object can be removed after bronchoscopy. Then if there is evidence of pneumonia, begin the treatment of pneumonia. And then how do you prevent this foreign body aspiration? One, you make sure that you keep small objects out of reach by children. Avoid toys with small parts. Give children soft foods and cut them into small pieces. Avoid distractions during meals and supervise mealtime. Be vigilant in public places such as parks and playgrounds, as your child's safety begins with you. So you can teach this child also about safety and the dangers of putting small objects in their mouth. Be knowledgeable about little cardiopulmonary resuscitation and basic first aid tips, which was the major aim of this lecture. Thank you for listening. I hope you've learned a lot. In case you have liked, you can subscribe to my YouTube channel for more of these videos. Hit the like button. Thank you.